So I'm honored to have here Dr. Per Hedén. Per is probably the most famous plastic surgeon in terms of breast surgery in Europe and one of the most famous in the world. I've seen him many times as a resident, as a young fellow, and as a consulting plastic surgeon. You're one of my idols, and I'm really happy to have you here. Thank you for giving us your time.
Thank you so much for inviting me. I'm so happy to be here.
And it's not your first time in Israel.
Oh no, the first time I got here was a little special because I had heard so much about the problems with the Intifada and I was asked to come here, but I was
first Intifada.
The first time was like a little reluctant because people in Sweden say it's dangerous and actually. It started off by saying no, 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 and instead of going here, the company brought a lot of physicians to Italy so I could do a demonstration operation, and then half a year later, I actually was persuaded to come here, and I almost regret not coming earlier because I realized that this is a very peaceful and very quiet part of the world, Tel Aviv, and such a beautiful city. So I love to come here, and I've been here many times now.
Thank you for coming because I know how busy you are doing so coming so many times to Israel and all over the world to your continued need for medical education. Where's the passion for medical education coming from?
Well, my passion for education is very much related to the fact that I get very good response. People really tell me that it helped them a lot in their practice. And I feel that it's a lot of giving back when you've been fortunate to gain knowledge, to have other more senior people who trust you and give you responsibility, then you have an obligation to give back. And some people in the past, were, I think, have been reluctant to share, saying this is my idea and so on. I've never felt like that. I always felt like I want to share as much as possible because it will help the specialty, which I'm very proud of, and it will help the patients. Because the more physicians doing better job, the better it is for the specialty, and it's better for patients. So I think it's an obligation for us when we gain knowledge and experience to share with others. And if people are afraid of sharing because they feel that this is my professional secret, then they should forget or should not forget the fact that when others have learned what you have learned, you're already on the next step. You already picked up new things.
Exactly.
So it's not like what you learned today is the end. I know that what I will do in 10 years from now, I will do different things than I do today. It doesn't stop. Development just continues, and it also relates to your own personality. You continue to develop.
I agree. So I know that you run and you own Akademikliniken. Where is it in Sweden?
Akademikliniken is in the city center of Stockholm, the main hospital. But with the growth of it, since we started in 1991, it's expanded throughout Scandinavian countries. And it's been growing to being 26 units, about 400 employees. And actually, I don't own it anymore because in 2011, we sold out to private equity. They did a very good growth of the company over 5 years. Then they sold it out to a venture capital firm, 2016, and I left a lot of my ownership. And actually, I'm not been totally happy with the way they run the company. So in May of this year, I left Akademikliniken.
Really?
Yes. Surprise.
Yeah, this is a bombshell.
So now I'm considering what the next step is, starting a new unit, starting a new Akademikliniken with all of the knowledge that I gained over this 30 years of entrepreneurship, sort of probably doing something completely new. Now I'm independent, I work with my own patients and do a lot of scientific work.
And what's your day-to-day? Do you only practice breast surgery, or do you do face surgery?
I do
everything?
A lot of facial surgery. I would say facial surgery is probably at least half of what I
Oh.
do. Breast surgery is obviously a large portion, but I do also many other procedures. I have a profound interest in facial paralysis patients. I've done a lot of muscle transplants, nerve transplants. I just finished a book chapter, actually it's just published, on the aesthetics of facial paralysis reanimation.
Amazing.
And I have a large portion of patients who come to me regularly for toxin injection, because I was one of the first plastic surgeons in the world to use botulinum toxin. And I was part of the introduction of HA also. So my interest in different fields of aesthetic medicine is wide, perhaps too wide.
It's too wide.
It's
What's
too
your
wide because
favorite surgery, though?
My favorite
To perform?
Yeah, you would be surprised to hear rhinoplasty.
Really?
Yeah, but I
my
really
God.
like that procedure because it's technically demanding. But I love facelift surgery and I like breast surgery. So I would say that would be, I think breast surgery, breast implant surgery, all different aspects of breast surgery, obviously, where I develop many new techniques is one of my favorite procedures, but also facial rejuvenation surgery with facelift, deep neck dissection, subglandular mandible gland resection, and so on. Yeah.
Interesting.
Yeah.
So when you coming up as a resident,
Yeah.
who did you look up to as plastic surgeons who are like, oh, I want to be like them?
I would say growing up in Sweden, obviously the local professors
Okay.
was the first ones you came in contact with, and Strömbäck, Jan-Olof
I know
Strömbäck, he
Strömbäck,
was
of
my
course.
professor, and he's an internationally well-known breast surgeon because he was basically the father of breast reduction surgery in many
Yes.
countries. And he contributed a lot to breast reduction surgery. And I looked up very much to the way he was as a person, wanting to share and being a very kind man. And he also gave me a lot of responsibility. So at that stage, in the beginning of the 80s, nobody did microsurgery. It was new in Stockholm region. And he told me that it's for you. And I was even not finishing my residency, and I was responsible for a totally new discipline in plastic surgery. So he trusted me, and obviously that was very useful for me in my development. And then obviously growing into the area of microsurgery, you also get a lot of people that you look up to, like the teams in Australia, O'Brien's group, and so on. And actually, it led to me doing a residency or like a senior registrar in Australia for a year in 1983.
Okay.
And then I came back and started head and neck reconstruction at the Karolinska Hospital with microsurgical procedure and so on. So, and then within aesthetic surgery, also a lot of people were very important for me. Fred Grazer taught me how to do liposuction, which was new in Sweden. I was one of the first surgeons doing liposuction. And I bought the liposuction machine on my way home from Australia in '83, and I built it myself
Really?
and started to do liposuction. It was totally new in Sweden. So it's a lot of pioneering work in my young days of plastic surgery.
So you had the good fortune of coming up with great people as
Yeah.
inspiration, but you did so much yourself. And the question is, if a young resident is watching this and he wants to be, it's hard, but the next Per Hedén, what would you tell him, even though I know it's a silly question, but probably maybe a pearl of wisdom?
I think most importantly is being very interested. I think passion is the key here. If you don't have passion for what you do, it's very difficult. I mean, if your interest for what you do is based on other things than a true passion, I don't know if it works. You have to feel enthusiastic and passionate about it. And when you are passionate about something, then you will definitely work on getting more and more knowledge. And passion could drive you a long, long way into being a good key opinion leader, because the more you learn about something, the more you develop. And the other thing is trying to look outside of the box. which is basically thinking about what can I do to improve this? Try to be innovative. Not every person is innovative, but always think like cross-scientifically. It's not just this area of plastic surgery. It's like this thing coming in from nutrition, this time coming in from basic medicine. There's so many things where we could cross-fertilize what we do, and trying to think out of the box and thinking about how can we improve this. And I think the foundation for starting with an innovation is actually establishing the fact that this is a problem. What we do here is actually not optimal, or the outcome here is not optimal. Why do we have this problem? If you critically look at the result, like a breast augmentation, it's bottoming out or whatever, you always have to think about what is the reason for this problem. Okay? What are the possible solutions? And what do I suggest myself? If you start that process, you will avoid a lot of horrible meetings where you sit down and discuss problems. Always think about what is the reason for this problem? What are the possible solutions? What is my suggestion?
So now, if I may, I want to take you to a fun part.
To a fun part. But this is fun.
Yeah, but funny questions. What is the music that you listen to in the OR? If you do.
Actually, you know, I'm like listening to everything, but the good thing is that I'm not the person who sits on Spotify and picks out my own list, but I hear really nice music that my son is playing, or a anesthesiological nurse, and I say
it could be whatever.
Put on your list. And sometimes, you know,
electronic, rock, hip hop.
I would say heavy metal.
Okay.
Too heavy in the OR. I like a mix, and I'm sort of eating everything when it comes to music.
Okay, so eating everything.
Yeah.
We're both aspiring chefs, and I just heard that you're kind of retracting your use of meat. So, what's your favorite dish now to cook?
Actually, I have so much to learn from the WFPB, which is whole food and plant-based, which is very much related to health. And it's amazing what you can do with vegetables. It's amazing.
So what do you do? What's your favorite dish now?
I still cook a lot of fish.
But local fish?
Local fish. Cod is I don't like salmon so much because it's usually cultured.
Yeah.
And cultured fish is like meat that's grown up in these animal farms, which is not
it's like
so
industrial
good.
meat.
Yeah, industrial production is not that good.
Okay, perfect. What's your favorite country to visit outside of Israel?
Outside of Israel, obviously, because this must be my favorite country. I must say I really love Brazil. I think the people are wonderful. I think it's such a nice country. And then I like Australia also.
First of all, I love you. Everybody is saying Italy. We've been getting Italy all the time, and you're the first one to say Brazil. That's great.
It is nice.
And I think that's it. Thank you for your time. I really appreciate you coming to Israel, especially in those COVID times, and giving your time, and hopefully inspiring our residents to maybe become the future Per Hedén, hopefully.
I hope these few words that we have spoken has been an inspiration to you, and I wish you all very great success. Thank you for having me.
Thank you for coming.